Hey ho, let's go. My name is Dr. MarkAlain Dery. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. As providers, we have drastically seen how the realm of public health has influenced our professional lives, whether we serve in academia, administration, research, in private practice, or within the hospital setting, or all the above. COVID has become synonymous with the term public health recently, and it has dominated our dialogue over the past year and a half, and rightly so. But we all know there are other issues that deserve attention too, but today's video podcast is going to be about COVID. So you best know that the ACOI, for providing quality of CME for physicians, both online and in person, more than providing internal medicine CME. The ACOI has been working diligently to keep you up to date by sharing updates of the ongoing COVID-19 saga, as well as expanding our coverage to other public health concerns as well. So let's get started. Let's talk about COVID hotspots and unvaccinated pregnant women. So we're going to go back to COVID-19 this week because it is the hot story of the week. It's simply too big a story to skip. So what's going on? Well, for one, we got kids going back to school and school districts pitted against some governor on mask mandates. Really? We're still fighting about masks? We have a large population of unvaccinated pregnant women and the danger of the Delta variant in some hotspots that are putting hospitals over capacity, creating a strain on all of us in healthcare. So those are a few of our topics of today. Just very, very lighthearted topics. No, these are very serious things, and let's get into it. First, the hotspots. This week, I saw a video from a colleague of mine who I've practiced with and who's an excellent infectious diseases doctor. Her name is Dr. Catherine O'Neill. She's the Chief Medical Officer at Our Lady of the Lake Regional Medical Center in Baton Rouge, Louisiana, just up the road here from New Orleans, where I am. And she articulated some sobering realities that I, too, have been seeing here in Louisiana, as well as many other places in the country. There's a link to her video statement, but I will summarize. The fact is that her hospital and many others like it have few beds left in their hospitals, and even worse, staff shortages that have now reached to critical levels. Dr. O'Neill spoke to the media, and the video has been posted on Facebook and other outlets where she gives some pretty frightening facts. A little more than 2 weeks ago, her hospital had 36 COVID-19 patients in the hospital. As of the day of her press conference, she had 155 beds of people with COVID in their beds, reflecting their maximum from last April of 2020. She represents the largest hospital in the state with nearly 800 beds, and she reported that they had 713 admitted just that day alone. Consequently, for obvious reasons, she is worried. She's concerned that people who come in with traumatic injuries from everyday mishaps, like a four-wheeler accident or motorcycle accidents or farming accidents, won't be able to get the care they need because of staff and bed shortages. To illustrate a specific example, my colleague, Dr. Joe Cantor, who's Louisiana's Chief Public Health Officer and excellent ER physician here in New Orleans, also reported that one person who suffered a heart attack was bounced from 6 hospitals before finding an emergency room in New Orleans that would eventually take him in. 6 hospitals just for one MI. As of now, Florida, Arkansas, Louisiana, and Oregon all have more people hospitalized with COVID-19 than any other point in the pandemic, and nursing staffs are badly strained. It's hurting all of us. It's hurting those of us who care for patients as we see our teams, ourselves, hit a wall. It's hurting people who are having medical emergencies who cannot get care. And now there's a group of people who are in extreme danger because of the two things that are coming together like a perfect storm. It's the group's low vaccination rates and how prolific, how infectious the Delta variant is. And who is that group, you ask? Well, specifically, pregnant women. So the CDC is urgently calling for pregnant women to get vaccinated. Why now? Because new data, thankfully, has surfaced about the safety and efficacy of vaccines for pregnant women, either taking them early, midterm, or late in pregnancy. And the recommendation also extends to breastfeeding moms. They are safe, very, very safe. And that is very good. It's a bit of a bright spot, some good news there. But the low vaccination rate in this group is a huge concern, according to the CDC, because as of July 31st, only 23% of those who are pregnant had received at least one dose of the vaccine against the coronavirus. Pregnant moms are going to the hospital very sick and needing oxygen. Some who survive are facing a lifetime of disabilities as a result. Two organizations, the American College of Obstetricians and Gynecologists, also known as ACOG, and the Society for Maternal Fetal Medicine, have sent out formal statements urging the vaccine for all pregnant women. A Texas physician who has seen a dramatic increase in pregnant women being hospitalized with COVID commented that the danger of COVID-19 isn't just for the moms, but the fetuses too, with complications that include preterm birth and prematurity. And because of increased risk of preeclampsia for these moms, there's a high chance for preterm delivery. We have a public health emergency here that could easily be controlled if everybody got vaccinated. It's very taxing for us in healthcare to see this unfolding needlessly. And I have stories of plenty of individuals who are on their deathbeds. This is hard for me to state because I'm aware of this, who are on their deathbeds and they're begging for the vaccine, and it's too late for them, and a grueling heartbreak for those of us caring for them. So please tell your patients to get vaccinated. The good news here is that we now recognize that and we've known this for a while, but now the data is in that that the mRNA vaccines are safe for pregnancy. But I'm telling you, somebody who's here in Louisiana who's practicing, it is brutal right now in New Orleans. All right, so moving on to COVID, schools, and kids. I'm hoping for some who remain unvaccinated, the weight of the responsibility of how they're contributing to the pandemic by infecting our children will help them change their ways. And I'm talking about a plethora of cases now in children. Dr. MarkAlain, also a colleague of mine, physician and chief of Children's Hospital here in New Orleans, reported a few days ago that the positivity rate for children in our outpatient settings increased from 1% a month ago to 7% 2 weeks ago to 20% now. According to our governor, more than 6,000 Louisiana children now have COVID-19. Governor John Bel Edwards said that this is the most positive cases in children since the pandemic began. We've had an RSV epidemic here in the South, and on top of that, we have the Delta variant, and it's creating additional illnesses, with children getting pneumonia-like symptoms such as respiratory distress, low blood oxygen concentration, and requiring supplemental oxygen needs as well. At least at the last count, 18 children are now hospitalized, with the youngest being 7 weeks old, and one of the patients is on a ventilator who is 3 months old. 3-month-old on a ventilator. Now, it's easy to say that kids can recover just fine, and very few will have serious issues. But what is not known are the long-term effects of COVID. Governor Edwards stressed that this is why children should be wearing masks when they return to school for coming days. And this week in the U.S., roughly a quarter of American children are headed back to school. And we're seeing measures by some states discouraging school districts from requiring masks, and crazy enough, punishments for doing so. This is insane. Yet school districts are thankfully fighting back, with the Dallas Independent School District and the Austin Independent School District, two of the largest districts in Texas, announced on Monday that all students and staff would be required to wear masks beginning this week, even though Texas Governor Greg Abbott had banned schools from requiring masks. Other school districts in other states, including Florida and Arizona, are similarly facing the same bans that their governors are pushing. This is putting school superintendents in tenuous positions. They are publicly stating that they are responsible for the health and well-being for their students and their staff, and so they are openly defying these, hear me out, crazy, unhinged, non-science-based anti-mask mandates. So look at the numbers. Just 29% of 12 to 15%, just 29% of 12 to 15-year-olds in the U.S. as of August 4th were fully vaccinated against COVID-19, according to data from the American Academy of Pediatrics. And children under 12 are not yet eligible for COVID-19 vaccines, so none of them are vaccinated. That is putting schools in a bad spot, hoping that other precautions, including masks, physical distancing, and ventilation, are adhered to in order to keep children safe from the virus. Families are also being put in a tough spot, too, with some schools having no mask mandates and the inability to go virtual. Some are masking their kids, hoping for the best. That isn't how the first days of school should be, with parents crossing their fingers that their kids don't get sick. Even in counties where the public health director is advising to follow CDC recommendations that everybody in K through 12 needs to wear masks, some school districts like the Cobb County schools in Georgia are just refusing to require masks. From a public health perspective, this should be non-negotiable. In fact, most Americans seem to agree. A Kaiser Family Foundation survey released this week shows that 62% of parents of aged 5 to 17 think that their children should require that their child's school should require unvaccinated students and staff to wear masks. We're already seeing the flood of cases due to the school's year starting. A school in Clayton County, just south of Atlanta, already shuttered an elementary school and returned to virtual learning for a week as a precaution, citing COVID-19 transmission rates. Across Mississippi, nearly 5,000 children, educators, and staff were quarantined, where 69 outbreaks were reported between August 2nd and 6th, the second week of school for some districts. And this also has resulted in nearly 1,000 children and 300 teachers and staff testing positive for COVID-19, according to a weekly report from Mississippi's Department of Health. Look, folks, this is an easy thing. We all need to be masked up all the time. And the idea that we are somehow politicizing wearing masks and citing zero science in doing so is something that we need to fight back against significantly. So stay on the lookout for these updates and to read more from these sources used in the report. Oftentimes I say, but read below, but that's not the way it works here. But you can go to acoi.org/resources together with the ACOI. Hello, ACOI. Thank you for letting me do these videos. We will help you have the latest information to help you respond to your patients. And as always, I love hearing from you. Please feel free to reach out to me at madery@mac.com. Please stay safe. And as always, thank you to Gina for a brilliant script. Thank you so much. Bye-bye.